in the differential diagnoses, the other things that can be happening in addition to this May-Thurner syndrome are some kind of growth, like malignancy or lymphadenopathy, which is congestion of the lymphatic system. A hematoma is like a big collection of blood from an injury, typically a lot of trauma in the abdomen. Cellulitis would also be like tissue that's inflamed, but probably from infection. And then we talked before about uterine enlargement. This can be pregnancy, it could be fibroids, it could be other types of pelvic masses. Anything that would press back against that posterior wall of the pelvis and lower back. And then the retroperitoneal fibrosis. So that's when the fascia is suctioned on too tight around the aorta and the vena cava, and then the branches that come off of them. So these things are things, that we can deal with visceral and vascular manipulation. If we're talking about any kind of fibrosis of the fascia, fascial limitations, if we're talking about any kind of pelvic congestion, if we're talking about, uterine masses, those are things that have the possibility of being able to be dealt with to some degree